Good afternoon. First, I want to take this opportunity to applaud all of you for doing what you do every day and for sharing this great moment to celebrate. Why equity? Why now? You are in the right place. This is Advancing Behavioral Health Equity National Culturally and Linguistically Appropriate Services Standards, also known as CLAS Standards in Action. I give you who these amazing speakers really are. Feel free to look them up on the website and to read their bios. But I want to keep this ball rolling so you can hear from all of them. First up is Tom Cordere. He is SAMHSA's extraordinary acting deputy assistant secretary for mental health and substance use. With loads of public, private, and nonprofit services, Tom is the first person in recovery to lead the Substance Abuse and Mental Health Service Administration, also known as SAMHSA. And in his spare time, he's also SAMHSA's Region 1 administrator. Tom has worked with governors and with the Hollywood stars. Tom never says no and makes it work for the greater good, no matter the circumstances. He will set the stage and make sure you get a copy of the guide, read it right away, and he will also share the overview of the Behavioral Health Implementation Guide. Tom, you're up. Thank you.
Thank you so much, Dr. Rory. It's an honor for me to be able to be here today as the Acting Deputy Assistant Secretary for Mental Health and Substance Use at SAMHSA. Unfortunately, our Assistant Secretary, Dr. Miriam Delphin-Rittman, who would have loved to be here today, is not able to join us due to an unexpected scheduling conflict. So I'm pleased to be able to be here and pinch hit for her. And it's an honor to be joined also by Rear Admiral and Dr. Felicia Collins, with whom I've worked closely with during the last year. Dr. Collins is the director of the Office of Minority Health, and we both welcome each of you to this event to formally launch the Behavioral Health Implementation Guide for National Standards for Culturally and Linguistically Appropriate Services in Health and Healthcare. Throughout today, we're going to refer to that document as just the Behavioral Health Implementation Guide for short, because it is quite a mouthful, the entire title. I'm so glad that we have an opportunity to come together today to launch the guide that SAMHSA and OMH developed collaboratively. SAMHSA, as many of you know, is the agency that leads the public health efforts to advance the behavioral health of the nation. We've worked on a range of initiatives that involve policy, program, practice, equity, and so much more. At various leadership roles that I play in the behavioral health field, the CLAS Standards is always a great tool to keep close. Before we learn from our community partners on their real life examples of CLAS Standards in action for the behavioral health organizations that they represent, I wanted to share that the CLAS Standards can be used broadly. In my role as SAMHSA 1's regional administrator, I was able to launch a project called the Diversity Inclusion Project Showcase, or what we refer to as DIPS, to ensure that equity is happening in the distribution of resources across the New England region by introducing organizations who work in BIPOC communities to funders. Introducing the two individuals is the first step at helping them meet each other, get to understand each other, hear about each other's languages. And when these grassroots organizations are introduced, I always encourage them to highlight their services that align with the National CLAS Standards. I believe these services that correspond to the National CLAS Standards draw attention from funders. And I think that's really important. I think we're going to go to we are on the slide for the actual guide. So while the CLAS Standards were developed for all healthcare professions and systems, we've noticed that physical healthcare organizations such as hospitals, primary care clinics, and health plans tend to be early adopters of the standards. to increase participation and engagement with the standards among behavioral health providers, SAMHSA collaborated with OMH to develop this behavioral health implementation guide. And the guide underscores the ways in which the National CLAS Standards can improve access to behavioral health care, promote quality behavioral health programs and practice, and ultimately be able to reduce the persistent disparities that we've seen in mental health and substance use treatment for under-resourced minority populations and communities. To make this guide practical and adoptable for the behavioral health community, the guide provides concrete, feasible implementation strategies for the health and behavioral health care community to be able to improve the provision of services to all individuals, regardless of race, ethnicity, language, socioeconomic status, and any other cultural characteristics. The Behavioral Health Guide is organized by the overarching theme of the 15 standards. Each section includes a purpose, behavioral health scenarios, implementation strategies, and implementation examples. So thank you so much for your participation in today's event. We're thrilled to be able to share this important publication with you. And now I'd like to turn it over to my friend Rear Admiral Collins to say a few words. Dr. Collins?
Thanks, Tom. Next, we'll have Dr. Rear Admiral Collins, who is the Deputy Assistant Secretary for Minority Health and the Director of the HHS Office of Minority Health. She leads OMH in its mission of improving the health of racial and ethnic minority populations through the development of health policies and programs that help eliminate health disparities. A pediatrician, she has more than 20 years of federal service working to improve the health of vulnerable and underserved communities. And she is a stellar role model of what all offices of minority health directors should strive for. And she will share the intimate details on the guide and its connection to the national standards for culturally linguistically appropriate services in health and healthcare. Dr. Real Collins, you're up.
Well, thank you so much, Dr. Rory and Tom. It indeed is a pleasure to be here with you, with my good friends at SAMHSA, and with my new friends of all of you. And so really appreciate being able to lend my voice to this day today as we celebrate and think about the National CLAS Standards in action to enhance behavioral health equity. Next slide, please. Now, I always like to ensure that everyone has a high-level understanding of the work of the Office of Minority Health within the U.S. Department of Health and Human Services. So this is OMH in a whirlwind, as I call it. The mission, our mission, which is important in my mind to always be focused and grounded in, is to improve the health of racial and ethnic minority populations through the development of health policies and programs that help eliminate health disparities. And we achieve this mission through our functions that are centered around promoting policy, program, and practice adoption, and then involve partnerships and data and information dissemination and demonstration grants and evaluation. And all of those functions then come together, if you will, for our collective goal, which we call SQPQ, the success, sustainability, and spread of health disparity reducing, or you could say health equity promoting policies, programs, and practices. Next slide, please. So today I've been given the opportunity to set the stage for what others are going to share, those that are working in the field, as they come and bring their real examples of class in action. So just to be sure we're all on the same page, let's start with the definition of class. So culturally and linguistically appropriate services are services that are respectful of and responsive to individual cultural health beliefs and practices, preferred languages, health literacy levels, and communication needs. And they are services that are employed by all members of an organization at every point of contact. When we put the CLAS standards into action, we advance the goals of improving the quality of services, of advancing health equity, and eliminating health disparities. Next slide, please. So providing culturally and linguistically appropriate services results in a range of benefits, not just to the individual patient or client, but also to the provider and the larger healthcare system. And so this slide highlights some of those benefits. I'm personally committed to CLAS as it helps to improve the quality of healthcare and services by helping me as an individual provider or the larger healthcare organization improve our communication. And we know that improved communication always has a ripple effect that can lead to enhanced patient or client engagement, increased utilization of preventive services and follow-up care, and enhanced adherence to treatment. So I'm personally convinced that as healthcare quality improves, the overall healthcare costs decrease within the healthcare system. So for increasing quality of care and decreasing costs, that makes me a believer from the beginning. In addition, we know that the U.S. is becoming increasingly diverse, and this widening cultural and linguistic diversity between healthcare professionals and patients makes miscommunication more likely. Thus, an organization that provides culturally and linguistically appropriate services is better able to respond to the changing demographics in a service area. So as you can see, CLAS just makes sense, whatever way you look at it. It makes good business sense because you can boost an organization's bottom line and competitiveness in the marketplace while reducing costly medical errors and malpractice suits. From a social justice perspective, it's just the right thing to do. And CLAS is an important way to help reduce health and healthcare disparities because CLAS helps us overcome cultural and linguistic barriers, which can lead to improved quality of care and services. Next slide. So taking the concept of culturally and linguistically appropriate services, the Office of Minority Health, way before my time, actually published the first standards for culturally and linguistically appropriate services in 2000. And as many, if not most of you know, these are a set of 15 action steps that provide a blueprint for culturally and linguistically appropriate services and show health individuals and healthcare providers how to actually implement such services. Next slide. This slide shows a snapshot of the National CLAS Standards, and they are structured to include a principal standard, which is number 1, that serves as the foundation for all of the other standards. The principal standard is to provide effective, equitable, understandable, and respectful quality care and services that are responsive to diverse cultural health beliefs and practices, preferred languages, health literacy, and other communication needs. And subsequently, the rest of the standards fall under the 3 themes shown: governance, leadership, and workforce, communication and language assistance, and engagement, continuous improvement, and accountability. Next slide, please. So if we fast forward, before I get to this slide, so if we fast forward to 2000, when the National CLAS Standards was actually established, we arrive at where we are today, where we are here celebrating with SAMHSA, our sister agency, as we have collectively taken those national standards and step even further in the development of the Behavioral Health Implementation Guide for the National CLAS Standards. And so I do want to pause and just celebrate and applaud the entire SAMHSA team over what I've been told has been over a decade for this wonderful, wonderful achievement in partnership with the Office of Minority Health. And in particular, I want to commend three supreme champions. I can't even think of the words to describe their level of commitment to this work over this decade, and who are both my colleagues and my friends. And so congratulations to Dr. Mary Rory, Ms. Rosalind Holliday Moore, and Ms. Juliet Bowie because we want to celebrate you on this day because of the importance of this achievement. Here is a little note for those who may not be aware of the Behavioral Health e-learning program that is sponsored by the Office of Minority Health. And so as part of our work to support CLAS, we released an e-learning program for behavioral health professionals, which you can find on the website thinkculturalhealth.gov. And again, our colleagues at SAMHSA, who are always our partners in all things behavioral health, were truly instrumental in providing the subject matter expertise needed to develop this online program. Next slide. And then we could go to the next slide. So in closing, I just want to underscore the importance of all of the work that you all are doing out in the field, particularly in the current challenging time. And I want to do so with in the context of some data. So the Center for Disease Control's MMWR last year showed that younger adults, racial and ethnic minorities, essential workers, and unpaid adult caregivers reported having experienced disproportionately worse mental health outcomes, increased substance use, and elevated suicide ideation. Also, if we look at SAMHSA's 2020 National Survey on Drug Use and Health, we see that Blacks and Latinos have substantially lower access to mental health and substance abuse treatment services. So as you can see, now is absolutely the right time for us to renew our commitment to working together and to putting CLAS into action via the new Behavioral Health Guide. So I want to thank in advance the organizers. I want to thank in advance those who are going to present and show how this actually translates into real world action, and just applaud all of you as we continue this work together to improve behavioral health care across our nation. Thank you so much.
Thank you, Dr. Rear Admiral Collins. And I want you all to follow her as an exemplar. She did that in 9 minutes and 10 seconds. Thank you so much for keeping us on track. All right, so now you certainly do not want to grab coffee or move because you would miss our community organization superstars. That's right, and that is what I said. I get their autographs right now because they are in the Behavioral Health Implementation Guide. Moreover, they could have said no to this invitation. Mary, I got my hands full, it's overflowing, but they said yes, and they are here today. So they are going to share the good, the not so good, and next steps on using the Behavioral Health Implementation Guide for CLAS. First up, we will break this out in the 3 themes. So theme 1 is governance, leadership, and workforce of the Behavioral Health Implementation Guide. And this will be covered by Monica Johnson, who is the director of the Georgia Department of Behavioral Health and Developmental Disabilities, Division of Behavioral Health, AKA Director of Everything, and her supporting and equally amazing director, Jill Mays, who is the director of the Office of Behavioral Health, Prevention and Federal Grants for the Georgia Department of Behavioral Health and Developmental Disabilities, where they are overseeing Georgia and making sure Georgia is on tap. All right, Monica, you're up. Thank you.
Thank you, Mary. Thank you for the invitation. We're happy to be at the CLAS party celebrating with you all in the country today. This is exciting. So I'm going to speak really fast. There's a lot of information that we will leave for the participants, but I want to walk away with a couple of key points. Jill, you can keep going with a couple of key points. So we were asked to think about policy into practice. And what I want to do is give you 5 takeaways of what we have learned and how to do this from a state government perspective. So number one, we just saw some data. You have to be able to use that data and put it into practice. The data and the facts matter. Don't ignore the data. So if you are in a position of being able to do policy and planning and program development, use the data to help drive those decisions. The health and equity information is at your fingertips, and it is real, and it is something that you cannot ignore. Number two, always use the voice of lived experience. That is absolutely necessary in every level of this work. Investing in the workforce includes that, but really wanting to underscore how valuable it is to listen to minorities, to listen to individuals that need access to ASL fluent clinicians, language, culture, all of that. Listen to those people. Be creative, think outside the box. It may not be what you always do, but it's what you do moving forward. Think about how do you go about measuring and monitoring outcomes. We've been given kind of a blueprint around here is the class standards. How do you monitor it? Is it really improving access to care? Is it improving better or giving you better clinical outcomes? Having a way to measure what you put in place via policy, via programs is the utmost important. And then I'll leave you with the last point, leading by example. So for me, what that means is diversity matters. It matters at every level of this work, from the top to the middle to the bottom, all the way back through. So making sure that you have a representation around you that is informing this work that looks like the melting pot of what this country really looks like. So that's important. And then I'll leave Jill, before I kick it to Jill. Jill, go to the next slide, please. I want to leave you with what I mean when I say think outside the box. So we are state government, and what we have been able to do, what you see here, DBHDD is here to help, and the ASL signing that you see, this is actually on the, this is a part of a media campaign. It was on MARTA buses. MARTA is the Atlanta Metropolitan Public Bus Transportation and Transit. This was on the buses here in the city of Atlanta. So being able to make sure that you're putting into practice, how do you get out and educate and inform individuals is really, really key. Don't do what you always do. Think about how you can be creative. And we've been really good at using media campaigns to really, really get our point home. So with that, I'm going to transition to my partner in crime today, Jill Mays, and she will pick it up from here. Jill?
Great. I was on mute. I apologize for that. So I'm going to talk about the current status of our work that was highlighted in the implementation guide and tell you where we've gone from there. We've certainly taken that and run and built on that. The project that was highlighted in the implementation guide, our SPIF-RX program in our Office of Prevention created, along with Emory Southeast Area Education and Training Center, a set of 4 videos designed to help providers to be more well-versed in the class standards and how that would look on the ground in implementation phase. The 4 videos were the National Standards for Culturally and Linguistically Appropriate Services, Cultural Competency with LGBT Populations, Behavioral Health Services Needs of the Hispanic, Latino, and African American communities, and the final video, Working with HIV Populations. And the providers in our programs use those videos to train their project staff and their organizations on diversity. And then we updated those in later videos. Those videos were posted, as you can see here, on our agency website, where they live now in perpetuity. But again, we built on that beginning. And if we could just put it out here really quick up front, a tip that we would offer to other states, other partners, is that effective implementation of class standards has to be multi-tiered. It starts, as Monica said, with policies and procedures, and that's how we communicate to our workforce across the state that this is a priority here in Georgia, and that the Department of Behavioral Health and Developmental Disabilities, we're going to put our policies, our procedures, and our funding where our mouth is. And then to continue with workforce development, which is very important. And then finally, very intentional, targeted promotion of services and programming. So an example of some policies, and to just give you an idea of how deep we go with that, we even have a policy related to food choices and menus at our hospitals that clearly defines that the menus are designed to meet individual choices and tastes, consistency of food, religious observances, and ethnic and cultural background. So even in the development of menus, we want it known that by policy, we expect our providers and our hospitals to be looking at every area of individuals' lives and where culture needs to be brought to bear. In our policy manual that governs all providers who are contracted by and funded by the state here in Georgia, and also through our federal grants, many of our programs are required to have an organizational plan. And that organizational plan says that they must be able to describe that they have a governing body or some type of advisory structure that indicates how the work that they are doing in their particular service or agency meets requirements for, number one, peer leadership, and number two, cultural diversity. And then we also require that across the board in all 159 counties, all service providers, that within the first 60 days of employment, all staff who have direct contact with individuals, and if you think about everybody working in every position at an agency, from the front desk to the janitorial, to the security staff, to the clinical staff, everyone at some point may have direct contact with the individuals that we serve. So they're all required to complete training in ethics, cultural competence, and cultural responsiveness. So that's how we demonstrate on the policy and procedure level that this is a priority for the department. Then, of course, we built on those first 4 videos, and we have a program now called Diversity Works. And that title is kind of meant for 2 different levels. One, to say that diversity works here. Our staff across the state is very diverse in terms of gender, ethnic and racial background, gender identity. So diversity works here at DBHDD, but also diversity works when we're able to focus on all of the wonderful differences and unique qualities that we all bring to the table. We find that it works better for the work environment, but also for those that we serve. And the Diversity Works training series that we've built over the last couple of years, we started it in 2018, and it's a 16-month program designed to equip participants to have a more meaningful conversation and thoughtful interactions across diverse populations that they serve. The series of webinars and in-person trainings, and of course, COVID kind of threw us a little curveball in terms of getting our in-person training up off the ground, but we have started the series of webinars that are designed to equip participants with new skills, new tools, and new strategies to have those meaningful conversations and those thoughtful interactions that guide the services that we provide, and that let the individuals who come to us for services know that we thought about them. And in terms of workforce development, it doesn't just stop at the Diversity Works series. We have 2 major conferences that the department puts on. One is our System of Care for Children and Youth Services, and our Behavioral Health Symposium, which is for all providers across the state. And in each of those major conferences, we have a cultural competency tracks that has 3 days worth of continuing education options for providers to take part in, to increase their knowledge, increase their skills, and to increase their comfort level in having what sometimes may be difficult conversations, but conversations that lead to better outcomes. Next, intentional promotion and programming. I'm a lover of public television, and I always loved Ernie and the Cookie Monster on Sesame Street. And Ernie used to sing a song called If I Knew You Were Coming, I'd Have Baked a Cake. And there's a video showing him interacting with the Cookie Monster where Cookie Monster comes and Ernie's like, oh, if I knew you were coming, I'd have prepared something. So Ernie busies himself baking cake. And Cookie Monster looks at the cake and is like, okay, well, yeah, thanks for that, but I want cookies. And so we take that when individuals from diverse backgrounds come to us for services, we already want to have prepared the services that will meet their needs and let them know that we see you on all levels. We thought about what would be important to you in terms of your treatment and recovery, and we're prepared to walk alongside you in that journey. We also, in our media campaigns, we make sure that our media campaigns reach all audiences across the state. Our major state opioid response campaign, we present that in several languages across several platforms, media and social media. Our prescription drug campaigns are in several languages. You have an example here of a Vietnamese naloxone messaging. So we have these in several languages. Our prevention project that we use to promote health equity across the state cover deaf services. We do cultural festivals where we partner with cultures in their communities to do things that are important to them culturally, with entertainment, but we also provide very focused behavioral health information as well. We're developing projects with beauty shops and barber shops and working with gatekeepers to the African American community and the community of women to bring behavioral health information right to them in their community. We have
Jill,
yes,
I'm loving you. I am. You need your own show.
Okay, we'll go right through, Mary.
Okay. Thank you.
This is an example of all of these programs that I was telling you about. And of course, this information will be available at the end of the presentation. But it's all about strategic partnerships and getting together with those in the community who are just as passionate about this work. And what's ahead, we don't know. We just know there's still so much work to be done and that we all have to continue to work really hard until everyone in all of our communities has a fair and a just opportunity to be as healthy as possible. So thank you for the time to just let you know a little bit of what we're doing here in Georgia.
Thank you so much, Jill. All right. Now we have theme 2, and we're going to be transitioning. Theme 2 focuses on communication and language assistance of the Behavioral Health Guide. And this will be covered by Dr. Sudarshan Pickerel, who is the Executive Director of the Bhutanese Community of Central Ohio. Not only is he here sharing his behavioral health implementation guide experience, but he is also serving on the Office of Behavioral Health Equity National Network to Eliminate Behavioral Health Disparities Steering Committee. He's also here in the midst of a very traumatic situation that's going on with his community. So Darshan, our prayers are with you in your community. And when you talk about commitment, you all could certainly look him up in the dictionary and you would see next to his name, Die Hard Committed. Dr. Sudarshan, you're up. Thank you so much for being here.
Can you see my screen?
Sure can.
Okay. Thank you, Mary. And thank you, everyone, for putting this presentation today. One quick correction, Mary. I don't have PhD or a doctoral degree. So
you're a doctor to me.
Okay, thanks. Then ask me to treat you. That will be a disaster. So, all right, I'm very honored to have this opportunity to present today at such a national event. My name is Sudarshan Peckerel, currently serving as the Executive Director of Bhutanese Community of Central Ohio. Bhutanese Community of Central Ohio is one of the community-based nonprofit 501c3 community organization, and it's also one of the largest Bhutanese population here in Central Ohio. I will walk you through, okay. I'm trying to go to my next slide and, okay, all right. So overview what we do through BCCO. If you look at our mission statement, which clearly shows today's topic, and it says to serve community members with culturally appropriate social services and empower them through education and advocacy. Now, BCCO was started in 2009. It was called BNCC, Bhutanese Nepali Community. We actually started providing community services through an agency with an office in 2014 when we got our first federal ORR grant. Since then, we have been actively working with national partners and local partners to provide post-resettlement services. Now, post-resettlement services could be a little bit loaded for new folks, but generally when refugees come to United States, they have a window of 90 days, which is called RNP period, which is receive and placement. That's it. That's the federal government support for 90 days. And you can imagine if you go to a new country with no skill, no language, you have 90 days to make it out. It often does not happen that way. And it is where community organizations like us, we jump in to provide additional support to these newly resettled families. That is what we call post-resettlement services. Post-resettlement services includes everything the families need. And it's good that I don't have to say next slide. Now, coming to the meat of the substance here, why implementing National CLAS Standard is important. You already saw that BCCO was started in 2009 as a civic organization at that time. And then let me tell you one interesting story. The pictures you can see up there, that's the picture while we are fleeing Bhutan. We are a victim of ethnic cleansing in the Bhutan. Bhutan is now tried to claim is the happiest nation, but you would know 1/6 of its population were kicked out of the country in the 90s. And we spent around 2 decades in a refugee camp in Nepal, and then we were resettled into the United States. Thankfully, we are very, very thankful for this opportunity. The first family to arrive in the United States was in February 28, 2008. In 2009, community leaders put together a civic association, and they said the mission of BCCO will be to provide culturally appropriate services. Why they felt that way at the time? Because they quickly realized that though there is a great service in terms of healthcare, school education, and whatnot in the United States, but if that service is not delivered in a culturally appropriate way. So when we say cultural at that time, we mean language as well, because we are anthropologists to some extent by our experience. And it includes both. Until and unless there is a cultural component and a language component in a service, the service does not translate well. Now, from my own language, I'm trying to give you an example. If a community is a person, language and culture are the eyes and ears. Okay, so if you want to communicate with an individual, and if you're not engaged, if you're not engaging their eyes and ears, you are not communicating. As simple as that. Whether it be a healthcare, whether it be social services, whether it be education, if you do not engage their eyes and ears, you are not communicating. It's all about communicating. That's our goal. And then since then, we have been implementing the CLAS standard, or at least advocating for the CLAS standard. Now, I want to give you one example. How does this translate to or relates to the National CLAS Standard? Bhutanese community is, of course, considered one of the successful refugee resettlement program. However, we have one sad or a little bit a sad side, which is the mental health. Bhutanese community has one of the highest suicide rate in the nation, and we have one of the highest mental health issue in the community, although community seems to be doing very well in other areas. And it was a big issue back in 2010, 11, 12. Nobody wanted to talk about it. We were very new. We didn't know much about mental illness, and we didn't know how to communicate. Thankfully, through SAMHSA, we found an amazing advocate, Dr. Adhikari, Surendravir Adhikari. He took us to SAMHSA and say, guys, this is the way to do it. And we came up with this project. And Rosalyn Moore is here. She is more than a person. She is my sister, maybe from previous life. We believe in many lives. So, and she said, Sudarshan, this is the way to do it. We have to translate this thing and relate to the community. Simple as translating the 5 emotional suffering, a new chapter begin in the Bhutanese community to talk about mental illness. How did that impact? Well, when this thing were translated, we came back into the community, started talking to the community members. And it started showing this is all the community is going through. See this suffering, and we talk to them. Then slowly people community members begin to realize suffering is universal. When language changed, the perception changed. We were having a difficult time communicating, although we were putting together a cultural event, a society stop event and whatnot. But when people begin to see that it's not only me, everybody is suffering, they understood that suffering is universal. It relates to me. And that changed the direction. If you really took a look into the mental health services and perception in Bhutanese Nepali community after 2005, the needle points to the right direction. Now, a lot of community members actually are coming out and seeking help to get mental health services. I know this is a 10-minute, and then Mary is looking at me, Sudarshan. You will meet my expectation, as I will do. What are the challenges? Of course, still we say language and cultural barriers are big challenges. Suicide, mental health, providing mental health services is a big challenge in the community. Now, given time that we have been a strong advocate. I've been working with SAMHSA and minority health to bring about what we are doing on the ground. And finally, after a long periods of working with community partners, we are planning to provide mental health counseling services through BCCU starting next year, 2022, to address this challenge. Quickly, what are our successes? Well, interestingly, these are some of the news clips that I'm sharing, but to be on a news does not really say you are successful or your work was successful. But in Central Ohio, a small organization like BCCU, which total our annual budget is less than $300,000, we are actually constantly storming on the news by doing good things. And one of that was the BRAVE project. When the nation was crippling through the COVID pandemic back in April 2020, BCCU launched a BRAVE project, Bhutanese volunteer project. And at the time when SAMHSA and CDC were talking about providing PPE, we were actually distributing PPE. The BRAVE project became so successful, it was implemented in 12 different cities in 7 different states within the Bhutanese community and outside Bhutanese community. We were creating Facebook Live videos, we were talking, and we were bringing experts into the team. We had 68 nurses, 4 primary care physicians, Nepali speaking primary care physician, working with us into that project. And we are every single day from morning 8 a.m. to 11 p.m. in the afternoon, somehow, somewhere else, we were engaged with the community, making short videos, addressing phone call, providing one-to-one orientation and educating community members about what is COVID and things like that. We were able to help thousands of community members when big institutions and agencies were just thinking about how to approach. So this is the community approach. I hope BCCU had really changed the trajectory in addressing mental illness and community services. With my last 1 minute reminding, I wanted to say that it is time now we have to start listening to community-based organizations. They are really the key player. They do the services where bigger agency cannot go. They bridge the gap because they are not only community leaders, they are part of the community. A person suffering from let's say mental illness or somebody dies in my community, I feel the pain. I feel the responsibility. I feel that I am missing. And that is across the community. It's not just the Bhutanese community. Now the time has come that federal agency need to work hand in hand with local agency and break this barrier and build this bridge. We will be able to overcome these mental health challenges. And I have shown this, we can do it together. That's my message. Thank you, everyone.
Thank you. All right. Next is theme 3. It's the final theme, but it's engagement, continuous improvement, and accountability of the behavioral health guide. To round out this power hour of news that you can all use is Miss Liliana St. Clair, Project Director at Day Springs Community Service, Preferred Family Healthcare, who is very humble, mega talented, and hardworking community organization superstar, getting up every day to make sure Oklahoma is scoring high marks. Liliana, you're up.
Thank you for that welcome. Buenas tardes, mi nombre es Liliana. Es un placer de estar con ustedes hoy. I'm very grateful to be here with you today. I wanted to share just a little bit of where I'm from. So I'm from Redford, Texas, which is a very small blip in the map on the Texas border. And so if you see here with my picture, you can see that is the Rio Grande, and on one side is Mexico and the other side is Texas. And so growing up there, it was really important. Language was very important. And so being able to have services that met the culture for that area was really hard. And so part of that is what pushed me right to go forward. And so I tell you that because we're going to fast forward to now being in Tulsa, Oklahoma, which does not look like that. And so part of being, when I moved to Oklahoma, it was trying to find a place that was as passionate as I am about making sure that services were culturally appropriate. So that's where Day Spring Community Services comes in. We are a part of a bigger family, the Preferred Family Healthcare family, that really covers 4 different states, and we have many different programs. But really at the core of it is making sure that our services are appropriate for the communities that we're in. And so really everything that we do kind of has that thread, right, of making sure that services are appropriate and that they are to the level of what we need in our communities. And so I think we all know the why implementing, so I won't go too much into that. But one of the things, right, looking at our services here at Day Spring is we really believe that by implementing the CLAS standards that we do have, that they are person-centered, right? That our client is at the center of the services we provide. And that by doing so, those services and the effectiveness of their care is increases. Now, of course, you could take my word for it, but that would not be why I was asked to be here. And so when we look at theme 3, right, which is what I was asked to be here, it's really looking at that engagement, the continuous improvement, and the accountability of our services. And so the way that we kind of know the why, and I think you've kind of heard the how, right? But now it's how do you keep building on that? How do you make sure that you are meeting those needs? And so really we look at a couple of different things, right? So kind of at the center of all that is our programs, right? Making sure that our programs fit the needs of our community. And so the only way we know that is by using the other tools at our disposal. And so the other tools that we have is really our informatics team, right? And so our informatics, that's our IT department. That's all the data collection. That's everybody that's kind of behind the scenes that looks at our EHR, that can do different reporting, and that really gives us that data that then allows the programs to make sure we're meeting those needs and then make sure that we're representative of where what the data is telling us. And so without that department, right, we wouldn't be able to ensure that our programs are actually meeting the needs for our community. The other piece of that is really our CQI team, right? We have a very robust CQI team. They meet monthly with all of the area program directors and all local leadership to just make sure that, you know, we're reviewing any survey results. And so we will send out surveys to stakeholders, to our clients, to our staff, and really making sure that we've addressed all of the areas. And so being able to implement that quality control piece, right, is really a piece that is able to go together. Now, we have sort of the other layer is our IDEA committee. And so what we have here at Preferred Family Healthcare is an inclusion, diversity, equity, and awareness committee. And so this committee is pieced from representatives from all levels of the company. So we have C-suite representative all the way to our staff that are providing services. And so we have HR, informatics, our CQI team, everybody is at the table, and they are truly given, this committee is given authority from our board to make sure that we are overseeing our policies, our procedures, overseeing HR hiring practices, and really making sure that all of these class standards are being monitored across the company. And so that committee meets monthly and has really its own action plan and fiscal year plan to make sure that we are reviewing and pushing the agency forward in being more culturally humble. So one of the things, obviously it would be impossible for me to share with you all of the things that we do to make sure that we're improving. But the one thing that kind of stood out to me was that accountability work, right? Is how do you know that what you're doing really is like that you will continue to do, right, what is expected. And so I really think it comes from the community, right? It's being involved in your community. And so if you're not sure, ask the question. Really be a part of any coalitions, be a part of any policy groups or things that are moving even any policies forward, interact with law enforcement, really be in your community and ask those questions. We really are trying to be wherever our clients are, right? This is just one example of one of our mobile units, right? It's a dental care unit that's able to go into the community, into schools, and making sure that that children have their dental health, right? But I think this is just one of those examples of something that we do to try to get into the community. The other piece of it, right, is really working with clients. They will hold you accountable. They will let you know if what you're doing isn't okay. I think one of probably the biggest indicator to know that if you're implementing the class standards is by making that comparison. Are the clients that are in your services, do they match your community, right? So just a simple looking at the census, a simple looking at the makeup of your community, and then looking at the data from your client base, does it match, right? If that matches, good job. If it doesn't match, you've got some work to do, right? And so that is how you can really kind of tell if you're doing services that really match what the community needs. One of the neat programs that Preferred Family Healthcare has is the Cqi program. And so this is something where we allow really our clients to express themselves through art, through music, through poetry. And so it's really a neat way to see people's behavioral health really being improved through the arts. And then lastly, it's your staff, right? Because your staff is part of the community. And so part of making sure that you are staying true to those class standards and truly sticking to the culture, we also have to recognize your own staff's culture, right? And understand that it is also their community that they belong to. And so really encouraging staff that have passions, that have ideas, for them to bring it forward. But also helping those that maybe are not as aware of their community, giving them training and allowing them to be more aware of what's happening in the world around them. Now, of course, I would love to be able to share all the other ways that we monitor and keep track of all of these standards, but that would be impossible. And so what I've done, because I know these slides will be available for you, so I've taken just a snapshot, and so there will be just a couple of slides that are going to be available for you that talk about how we monitor each of those standards. So as this was broken up into the 3 different themes, we just outlined just some of the things that we do on each of those themes as a way that's being monitored, whether it's through the Cqi team, our idea committee, and really how we monitor that. And so that is really what I have for you today. I appreciate your time, and I look forward to seeing all of the new adventures that this creates for everybody that's listening today.
All right. And so we have a lot of lessons learned. Yes, we will make sure you all get the recording. Yes, we'll make sure you get the slides. Thank you all for being here. But before we wrap up, we were supposed to have a Q&A. That's why we need 2 or 3 hour meetings, but we don't want to do that today. But what we will do is allow folks to close us out. So here's what I'm going to do. I'm going to give the floor to Rosalind Holiday Moore, who has just been an outstanding mentor and partner in crime through this whole process. Roz, you got 1 minute. And then I'll pass it on if Tom Cordere wants to close this out. And if not Tom, then we got Dr. Rear Admiral Collins if she's here. Other than that, I will go quickly with our panel to see where their lasting words. Okay, this is the power round. Go, Rosalind. Thank you.
I'm only going to take 30 seconds, Mary, and it's to extend a sincere appreciation and thank you to everyone who's contributed both as a presenter as well as an active listener. It's the partnership that will make this effort continue to be successful. It's a partnership that will allow us to learn from each other. And it is a partnership that will allow our communities to experience health and wellness in the way that they are most deserving. Thank you for the opportunity to join the conversation. And then I pass it back to you, Mary, for others who might want to speak.
Thank you. Tom Cordere, are you there?
I am here, Dr.
Very good. Tom, before you speak, amazing. Thank you so much. I love working for you. Now you can say what you want to say.
Yeah, no, we're really lucky to be able to work together on so many important projects. And this is one of them, as you guys heard from the presentations today, the very rich presentations today, which really not only made a lot of sense to me intellectually, but really touched my heart. And as a person in recovery myself, which means I haven't used alcohol or drugs since May 15th of 2003, I understand having to go through, having to receive services, having to show up and having to, be able to be part of that process where I can invite, folks in to help me. And, I can't imagine how difficult it is when you don't have somebody who has been, culturally or linguistically appropriately trained to do this work. And I was thinking about in our own region, just last month, I got to attend with my assistant regional administrator, Taylor Bryan Turner. We went up to, and all of our federal partners went up to Millinocket, Maine, at the base of Mount Katahdin for the ribbon cutting of a brand new Indigenous healing and recovery center. And what we heard there was some of exactly what we heard today, was from people when they walked into the center, how it was designed, how, the smells, the things, one of the participants said that they wanted to go to treatment and be in an environment where they could smell their grandmother's cooking. And they felt like this was the kind of place that could do that, where they could actually heal and where they could recover. And I think this is what we're talking about. You guys really put that face and that voice to this work today. So thank you so much for having me as part of this webinar today, and to join with you, Dr. Rory, to join with my friend, Dr. Collins, and our colleagues at OMH who have worked so hard on this project as well.
Thank you. All right. As keeping my word, let's see. Dr. Rear Admiral Collins, are you still here? Okay. I'm going to keep it moving. Okay, Monica, 10 seconds. What do you have for me?
Policy means nothing without the voice of the people. So I'll leave it at that.
Very good. Jill, what do you have for us, please? Okay. All right. Liliana.
The only
Okay.
way you know you're doing it right is if your client base matches your community.
Very good. Sir Dashi, what do you
Well,
have for us?
Communities are bridges in these services.
Very good. I'm going to get the last word. Closing remarks. President Biden has written us all a blank check for equity. We need your help to cash this in. Colossal thanks to all of you, our esteemed community organizer superstars, the planning committee, Dr. Delphin Rittman, Tom Cordere, for caring enough to carry out SAMHSA's mission and allowing partnerships like the one we have with the Office of Minority Health and Dr. Rear Admiral Collins and Rosalind Holiday Moore to flourish. In order for us to move this needle, we must develop and deliver prevention, treatment, and recovery services that ensure members of diverse cultural groups benefit from these efforts using innovation, system change, and strategic partnerships and collaborations to break down the silos. Thank you all so much. Stay safe, stay healthy, because we have so much work to do. Take care. Bye-bye.